You might have heard the phrase that when a baby is born, a mother is born too, and it is so true. A new season of firsts is quickly ushered in, and it's likely you're experiencing some very common run-of-the-mill things for the very first time. In this video, we are talking about 3 postpartum firsts that are sometimes uncomfortable, scary, or uncertain for new mamas. I'm Bridget, and I'm a childbirth educator, a birth doula, and a mama of 2. And if you're new to this community, don't forget to subscribe and hit the little bell so that you stay in the know with all the educational and empowering content that comes your way. So the first of the postpartum firsts that we're going to be talking about is peeing and pooping. After you give birth, either vaginally or a cesarean, your care team is going to want to make sure that you are able to go pee. If you've had an epidural or a C-section, you've had a catheter during labor that will need to be removed in the hours after birth as the medication wears off so that you can get up and go to the bathroom. The first pee, especially after a catheter, often feels strange, and it's because your baby had to pass through your pelvic floor, which your urethra, your pee hole, also has to pass through, and it's compressed against the pubic bone in the front during and throughout labor. Often it's pretty sensitive, and if you've experienced any abrasions or tears during labor, you'll also likely experience some stinging and discomfort as well. My tip for the first several pees is to use your peri bottle before and as you're peeing to spray the area with warm water. It makes it way more comfortable and easier to relax. You also might notice in the first few days that it's hard for you to hold your bladder, and you'll find yourself peeing yourself with basically no control. Again, this is very common after birth since your pelvic floor has experienced a lot of pressure from birth, so it's recovering and healing from that experience. However, this should not continue for the weeks or months after birth. If it does, it likely means that you have an unbalanced pelvic floor that you should seek care for from a pelvic floor physiotherapist. Pooping, even more than peeing, is daunting for postpartum mamas. It sometimes feels like you're going to push all the organs out as you poop, and that's not going to happen, but it can feel that way. If you've had tearing, it can be scary to go poop or be quite uncomfortable. Thankfully, if you are eating plenty of fiber and drinking lots of water, your poop should be soft enough to pass easily and without too much pain. Now, if you use medication during labor, such as an epidural, or you're on pain medication after a C-section, these things often cause a bit of constipation, in which case, along with the good fiber and lots of water, you'll probably also want to be taking a stool softener that your care provider will likely give you. Or if you want a more natural alternative, magnesium is a great option to help soften stools, and I have it linked down below. Another way to make those first postpartum poops easier is to use a squatty potty stool that elevates your feet so that your sitting stance is more of a squat position. This is something I actually recommend every person to use because it is actually the healthiest position to poop in that actually helps you pass all the waste more easily. Again, that is linked down below as well. And again, use your peri bottle after all bathroom trips and after going number 2, be careful not to wipe too hard. It's better just to dab if you can, and that's easier to do after you've used the peri bottle. The next postpartum first is sex. Sex can be scary to engage in after birth for many women. If you've experienced perineal trauma, had a C-section, or you feel birth was traumatic in any way, sex can especially feel undesirable. It's also important to note that your hormones are all out of whack after birth because you're suddenly not pregnant and your body is now rewiring itself to be able to breastfeed, or if you're not breastfeeding, it has to quickly rewire again to stop the production of breast milk. After birth, and especially while breastfeeding, estrogen hormones drop so low, which causes a decreased sex drive and vaginal dryness that causes discomfort during sex. When you're having sex for the first time, be communicative with your partner. Tell them it might need to be slow, that you might need to stop, or if something is making you feel uncomfortable mentally, physically, or emotionally. Use plenty of natural lubrication like coconut oil or vitamin E oil, and know that sex might be uncomfortable the first several times, especially if you've experienced tearing, and you'll want to get your care provider to give you the okay for sex if you've needed stitches to make sure that everything has healed properly before engaging in sex. If sex continues to be painful after about 8 weeks after birth, you really should see a pelvic floor therapist who can assess your pelvic floor and give you exercises specific to your needs to help create a healthy and balanced pelvic floor. Now, before I talk about the last postpartum Postpartum First, if you're feeling uncertain about what's to come after the birth of your baby, I created an extensive postpartum course that teaches you all about postpartum recovery and health, breastfeeding, navigating relationship changes, newborn care, and so much more to take away the unknowns and replace them with confidence so that you can have a happier, healthier, and easier postpartum experience. If you're not ready to commit to the birth and postpartum course, you can always take the free mini course that's linked down below. So the third postpartum first is your period. In my opinion, one of the best things about pregnancy and a portion of the postpartum period is that we don't have periods. If you're breastfeeding, you're less likely to have your period return for several weeks or months after birth. However, if you're not breastfeeding, it will likely return much more quickly. The first period after birth can kind of catch you off guard, so make sure you have supplies on hand after giving birth for whenever that first postpartum period comes. A lot of women share that for their first postpartum period, they experience much more intense cramping and they have more blood loss than they did pre-pregnancy. So this might be the case for you too. Very painful periods, however, might be an indicator that your hormones are imbalanced. So if this is the case for you, focus on eating as healthy and as balanced of a diet as possible and consider getting your blood drawn for a hormonal specialist to help you know where your hormones may be imbalanced and how to correct them. After birth, your vagina has stretched and more blood loss is common during your period. So you might need to use a bigger tampon or a bigger pad, but my favorite period product is the Flex Cup that is linked down below. There's a bit of a learning curve to use it, but once you get the hang of it, it's so convenient, healthier for your body, and better for the environment. Mamas, as you're navigating through the many postpartum firsts, be patient and kind to yourself. There's a lot of old things that you're experiencing for the first time as a postpartum mama. Hopefully, this video has given you some insight into a few of the postpartum firsts to make them less uncomfortable, scary, or uncertain for you. So thanks for being with me in this video, and I'll see you in the next one.